the vaccine to you. But we just received notice that we're going to get vaccine this week, and they want us to use 80% of it next week. So you can imagine the timing of that is not easy.
Right. Another thing I have not understood about the rollout, and maybe you can elucidate that, is, this goes back a few weeks. I knew quite a number of people who were not only 65, but 70, 75, who hadn't been vaccinated. And, these were people who they're not computer savvy. They can't be, refreshing their computer screen every 10 seconds. And a number of people I know eventually had luck calling these, you call some number and somebody helps you find a vaccine. And I could never quite understand who those people were. I had to believe they had some inside track that the average person didn't have. How did that work? Is that still ongoing? Or who sponsored that?
There was a state site to assist people. Some of them were through Department of Aging organizations. Cook County Wellness here in Reading has tried to help those people. And some of the health systems, part of the mandate that was given to us by the state as the vaccine provider is to have some ability for those who don't have internet access to reach out to them. So a lot of different vaccine providers try to set up, methods of phone calls. St. Joe's, I know, because I was on a call, they set up a you can call number, but people were on hold for hours to make it.
Right.
So, people did the best they can, but Cook County Wellness going forward is going to be part of a place where people can call them. They'll work with all the different vaccinating providers to find people appointments that are open for people who might not be able to do it, through electronic means.
Good. Well, it certainly seems like, tell me if I'm wrong, but it seems like in the last, since we met last, and particularly in the last 4 weeks, there's been a lot more vaccines given out. It seems like Pennsylvania has ramped up quite a bit in the last 6 weeks.
And there was a lot of attention to Berks because population wise, we were one of the most populous counties, and then vaccine distribution, we were ranked one of the lowest. So there clearly was an inequity of vaccine distribution to a high population area. And that got the attention of a lot of people who then advocated to get more vaccine into the county, which has resulted in more people getting access to vaccine. But in the beginning, it was disproportionate compared to our population, how much vaccine we were getting.
All right. Well, thanks for the update. Hopefully next time we meet, this will kind of be a non-issue that people will be wallowing in vaccines. Hopefully they still work. Just reading about the double spike now. There's a mutation not only in the spike protein but somewhere else. You got to stop reading the news. Just you're worried. Yeah. All right. Well, then anything on the subject of from the coronavirus update? Any other discussion on that?
No, I think what we're seeing with this new strain, as you bring that uplifting news, is that it is much more infectious, and it seems in places we're trailing behind other places. So when you look at them, what's happening with that strain, it's disproportionately affecting a younger age demographic now who are not vaccinated. So the 35-year-old, 45-year-olds, and even children seem to be now being affected by this B11 strain. So that's the fear of going forward with schools going back in person throughout the county. What's going to happen? Yeah,
it's a little disconcerting to see that our numbers have been up quite a bit in the last week or two.
Yeah,
you would think they should be dropping between the number of people who were exposed and the number of people with vaccines. You'd think that even though we're not at herd immunity, you'd think it would make it a little bit more difficult for it to spread. But like you said, people have been a little more emboldened to get out and do things they weren't doing before.
Yeah.
Maybe the warm weather will help us. Who knows? Good news is there's like virtually no seasonal flu from what I understood.
I was on a call. Reading Hospital reported no inpatient hospitalization related to flu.
Wow.
Well, that's a good thing, I guess. Yeah. It will be very interesting to see when COVID is totally behind us. Who knows when that'll be? Whether, every year they flu and cold season, they tell you to not go to work if you're sick and to cover your sneezes and this, that, and the other thing, wash your hands. And, for the most people, it goes in one ear out the other. You wonder whether people will have a very different opinion of, personal hygiene and, after all this. It was a good lesson in it, I guess.
Someone said, and I thought it was funny too, can you imagine blowing on your birthday cake at a party anymore? Blowing out the candles? We all did it. And then we think back like, oh my
I
God,
was
did
in
we
the
really blow
I
on
was
a
in
birthday cake?
market yesterday, and those little things that you put your vegetables in that are nearly impossible to get open. The way I usually do it is wet my fingers. There's no way I'm going to be wetting my fingers. I've got my mask on. I must have stood there for 5 minutes trying to get the darn bag open. But yeah, certain things you're just not going to do it. All right, well, let's move on then. On the old business health code amendment, I understand that has been outsourced. So we're waiting for that to come back to us for some action. Is that right?
Yeah, and I don't know if Fred has any update on that or not.
I do not. I imagine that would be in terms of, and what I did ask was for maybe like because there's, we're getting assistance with multiple, our building codes, our property maintenance code, as well as the health code. That would probably not be the first one, but I'm still waiting on any of them to get back so we can start reviewing them with our various codes departments. So I don't know exactly when we'll get the health code. And, I know when I was looking into it 2 or 3 years ago, it is pretty massive if we do a complete update of the what the FDA recommends as opposed to what the state amends. So I can check in specifically about the health code and see where we are with that, and hopefully have something to report at the next meeting.
Okay, so no action required today. Next subject is Berks Teens Matter. You may have reviewed, Michelle's sent around 2 things. One was their collective impact statement, and then another was their minutes from the last meeting. And it appears as though they're struggling a little bit to kind of keep up and running given the COVID situation. I had a question about the minutes. I just was curious about something maybe Michelle could tell us. On page 2, under update from Nadine, it said that they were interested in askable adult training and how to use it. And I was just curious what the concept of askable adult training was. I don't remember hearing that before, that term.
Yeah, so Berks Teens Matter is part of Coe County Wellness, and they have a program that's called Askable Adults, and it's essentially training adults in how to talk with teens, preteens, any kind of adolescent with any of their sexuality questions, whether it be, about specifically birth control or anything else. And it's just a way for you to learn how to react to them so they feel safe talking to you, and then how you respond to them, non-judgmental, informative, and not, that kind of response.
Yeah, I understand the concept, but is this like parents could come to a seminar and listen, or is this something to be taught to the adults who are going to be their mentors in school?
Yeah, I think anybody can go. At this point, they're looking at the middle schools, because that's where, we've all lived through it. Those are the tumultuous years when everybody's confused about everything. So I think they're looking at focusing in the 4 Reading middle schools at this time for that.
Okay. All right, good.
And there is buy-in from the principals, so they're excited about that.
Yeah, I know when the thing first came up a few years ago, there was pushback from the board, but I think one of the problems then was they were going to staff it with somebody from Planned Parenthood, and that rang some bells for some people, which were an issue. But it sounds like the school board or the school district is behind it, as far as I can understand.
Yes, there was a big input on that when it was first ready to open too. That's why there was all that. The people who are pro-life really misinterpreted what the Health Resource Center was supposed to be, and so that they put a lot of pressure on the board at the time. So
can't have an abortion if you don't need one.
Right.
Yeah, right. Yeah. Okay. Any other issues on Berks Teens Matter that you'd want to discuss, Michelle?
No, just to let you know that they are also still working on that name change, but nothing is coming forward yet on that.
Okay. And then the next batter was the Lead Abatement Coalition. Jamal last time had mentioned that he was going, I think he went to a meeting on February 23rd, and I didn't know whether he had any update. He had mentioned that there was a meeting on February 23rd. I don't know if he had any update on that. Do you have any information on that, Michelle?
I don't, but I can check. Bill Murray with the Water Authority is also involved with that, so I can check with him
If
to
there's
get an
anything that
update.
requires action on our part, let us know. And then another new member update. We were, I guess, Michelle, were you the one that was contacted from a young woman who I think is employed down at, is it, where, or you give us the specifics, guy? You sent it to me, but I don't have it in front of me. Somebody had,
We got an application from someone who works at the Berks County Planned Parenthood. She's interested in serving as the alternate resident position. Oh, there's Bill. Maybe he can give
Okay.
us an update then on the lead thing. But we have also since then also received an application from a former property maintenance inspector who now works for the Department of Health in Reading, who would be able to fill that environmental position that we
that would
have
be
been
great.
searching for all these years. So
Good.
fingers crossed
Okay.
that
Oh
we
my
get
God.
that position
Great.
filled.
Now,
Good.
I'm just, maybe I shouldn't even ask this question. Do either of these people come in with some agenda, like they want to like get fluoride out of the water or something?
Not that I'm aware, but I won't learn that until they have their interview with the Nominations and Appointments Committee. That's usually where those things kind of first come to surface.
Okay, good. All right, well then let's circle back from that. Now that Mr. Murray's here, let's circle back for a second. I just mentioned that on the subject of the Lead Abatement Coalition, Jamal had mentioned that there was a meeting on February 23rd, and I didn't know if there was any update on things from that meeting or whether there was anything that we should know about.
So I apologize for being late, but I was actually just in the meeting with the Lead Abatement Program for the last hour and a half. So I can give you a pretty recent update of the last two meetings. We are working closely with the EPA and the HUD folks. We've had a couple meetings now to try to get together an appropriate grant application and try to bring money to Reading so that we can get some kind of program off the ground. That has been pretty well vetted. We have a pretty good idea of what we want to do. And basically what we've learned is with these grants, they're looking at what they call capacity. And that means they're looking at the city and saying, if we give you $5 million, do you have the capacity to handle $5 million? How are you going to do it based on what you got? Which everybody understands in Act 47, you got to beg, borrow, or steal just to keep what you got, let alone try to get another employee. So it's taken a quite a path, but I think that we have commitments on behalf of the city at the highest level and also with RAWA at my board level to support this in any way we have to show them that this is important to us and we're going to make it happen. So we're going to be going out to the community, getting letters of commitment and letters of support. So the difference being, we'd expect Senator Schwenk to write a letter of a commitment saying that her office is going to make sure that any state money that can support the program, she'll take the lead with that to try to come in to help us support the program. It's not just as easy as just throw a program together. And let me address water specifically. So basically, we have about 3 years before we have to have some milestones that DEP and EPA have passed regarding lead and copper. These milestones are not going to be a problem for RAWA in any way, shape, or form, to the point where we've been, for the last 5 years, trying to find lead services into houses. It's near impossible. 2 months ago, I brought in my computer IT people, the outside vendor, and we did a search of all the customer notes where any customer ever mentioned a lead service. The reason we did that is we record that kind of stuff on the customer's file. So if we were out and we had a problem with the meter and we saw that there was a lead service, that person would have reported it and that would get put on their customer file. So we were able to find, quite frankly, probably about 250 out of 28,000 files where there was notes. We then started, drilling down on them, and we basically looked at the exact file. And then we went back into our engineering notes, the separate notes altogether, and looked to see if these properties were, lead, or whether we had replaced them, or what it was. Because you got to remember, there's a water main that goes down the street, and then there's from the water main to the curb is Rawas.
Mhm.
So we know exactly what that is, when it was put in and everything. And then from the curb in to the meter is the customer's responsibility. So we have some records on that, not all, because if a customer called in and said, I'm going to put in a new service, we noted new service. We probably didn't have all the materials. Lead didn't matter back in the day. So if it doesn't say copper, what we've been doing is going back out, going into the homes. We started out first just saying, hey, we want to check your meter. And we had an expert, one of our expert meter guys knew how to tell if it was a lead service line going into the house. We also have photographs of every metered connection. So we're doing exhaustive efforts trying to find them. Well, we finally actually in that process got one where the meter guy went in and said, there's lead service. There's lead service going into this property. The unfortunate thing was the property ended up being a 4-unit. And my program that I had taken to my board was simply for free lead service replacements for owner occupied residences. So I had to go back to my board, and they readily agreed to it because we budgeted for 25 services a year, single services. So what I said was, just expand it to up to 4, and that'll count as 4. So in the end, it's actually, if I ever get to 25, which probably will never happen, but at least it'll be actually cost effective to do it's more cost effective to knock 4 out through one service than to do 4 individual services. So I was able to convince them to do that. So we've expanded that program, and that's pretty far reaching. And Michelle can tell you, there's a lot of 2 and 3 and 4 units in the city, so pretty much everybody except the big guys are covered if they have it. So if we learn about it, we're going to replace it for them. So the long story short is we've actually had to create a committee at Rawa to basically develop how are we going to do this. It's easy to go, well, here's the way they do it in Pittsburgh, and here's the way they do it in Toledo, Ohio, and here's the way. It's just not apropos to what we do here in the city of Reading. It has nothing to do with, they're that far off. So we've created a committee, and it's been really, really rewarding, and to everybody on the committee, because we're actually almost like gold miners now trying to find gold. And when we do it, everybody gets excited about, hey, let's figure out how do we help these people. And then I'll just tell you, we called the one guy and said, listen, you have lead service. So we had customer service call. And of course, that wasn't good enough. So the call got turned over to my administrator. 30 minutes on the phone later, it wasn't good enough. I spent an hour on the phone with the guy. And I said, look, let's get to the bottom line. What are you afraid of? We're going to do it for nothing. I know I'm here from the government. I'm here to help you. That's a pretty tough sales pitch, but we are sincerely going to help you. And even if you want to do it with your plumber being there, whatever, we'll work something out with you. We don't care.
Yeah.
And the guy was basically, then he got honest with me and he said, I'm concerned about my liability. In other words, he's had the place for like 25 years. What if somebody comes back and said, my kid, is sick, and it's because when we lived there, you had lead.
Oh, okay.
Okay. So then I explained to him, I said, well, I appreciate that. And it's pretty hard to get sued for something you didn't know existed.
Yeah.
But now that we've had this conversation,
Now if you don't do
it. I said, so from today going forward, you're on notice is what they call that in the legal world. So you better figure out it's time to do something. And
well,
so he jumped in, And of course, we had his water tested. Thankfully, even with the lead service going into his house, the water has a corrosion inhibitor added to it that coats the linings of the metal. He came up really, really low with lead and copper, well below any limit. So, in the end, even though we did find a service, it appears, the good part is it appears our corrosion inhibitor program is working very well.
Good.
That's the only way you can ever tell. So as far as, and I really do apologize for not being able to jump on, but Doug's meeting, in fact, I left a little bit early.
right.
And I think that you guys are going to have a place in this program going forward, because there's things that every entity brings a certain element to a successful program. I would ask you, if you have the opportunity, Lancaster is like in the local area, they're the leaders of this. They really have a great lead abatement program down there. They've been at it for 4, 5, or 6 years now. It's really sophisticated. And on YouTube, they have a video, do Lancaster lead abatement, and it's called Now I Know. And basically it's a 3-minute video that they put together, and they interviewed parents of these kids that are sick from Lancaster.
Mhm.
And I will tell you, you better take a tissue with you, because you're going to be saying, there but for the grace of God go I, because you really feel for these people. And the bottom line is they didn't know.
Yeah.
So the first thing we know we can do is we can get the word out. Even if we don't get this grant, RAWA is going to be committed to totally advertising this and going after state money ourselves to advertise, the situation with lead. And it's not from water, to be honest with you. It's not that you guys know. It's coming from the old housing stock.
Yeah.
We know that. We all know that. But as long as people think of lead, they think of Flint, they think of all these bad things. Fortunately, we don't have, knock on wood, we do not have that problem to deal with.
Yeah, we do. From the primary care standpoint, we had a higher rate of lead poisoning than Flint. And at Berks, we serve a lot of patients. We just had a kid with a lead of 55 just last week. And I personally have, stories of patients who developmentally were affected by lead poisoning. I've been here now 18 years, so I've been able to see a lead poisoned kid grow up and realize that his ability and mental capacity were functioned by lead. And as you were talking, I thought about the insurances are now required when a lead is 5 or higher to perform a home assessment and evaluation. Is the pipes and the waters ever part of that, or in collaboration when you have an identified home of a lead poisoned child, is that a potential collaboration? Because they pay some organization and you get these pages and pages long reports of the window sills and the paint and the soil, but I don't remember an assessment of the pipes and the water when you get those kids who are lead poisoned.
So Mary, so basically with the lead abatement programs, there's 2 areas you get it from. One is from either through the water and drinking it, or you get it from the dust and the paint and all that kind of stuff. Reading we very well have vetted it, trust me, that the water is a very low probability of the cause of any of those. But the law won't allow you to just throw it out the window. So the EPA and the DEP are now requiring us to even maintain lists of any property where we have knowledge that there might be lead. And there was construction done, back in the day, that there's actually lead pipes in houses. I mean, lead pipes in houses, like well past the meter. Well, a lot of times in the Reading, what we see is the basement where they can readily get to it has been upgraded to copper. But once you start talking about going to the 2nd, 3rd, or 4th floor, they're not really too interested in that, because that's a very expensive proposition. So if insurance companies are jumping in there, I would say that that's important. But the whole, and that's interesting that you said that. I'll pass that on to Jamal and our group, that the insurance companies might be willing to pay to upgrade a house, is what you're saying?
They pay for the inspection. So they're required to pay for an inspection if a kid's lead level is 5 or higher. But most of the reports that are ringing in my mind are the window sills, the dust, the soil, the outside backyards. I don't remember, maybe because it's not a high lead part of it, that, they even test the pipes in the water. That's what I'm not remembering. But if they do test it, maybe it's not popping in my mind because it's not a high source of lead compared to the soil and the window sills and everything else.
Yeah, so in Lancaster, they actually test for lead in water when they're doing their process. And they've got a little different situation. They've got a lot more lead down there than we do. And they actually then list that property on the list of lead certified free. And then every 2 years they do tests. They come out and they look at the test and they have to get recertified. The idea being that's where that we didn't know, attitude comes from, that now you do know. If you're a parent in Lancaster, you can go and look at the list. Is this a property that I want my kid in? Is it lead free? Has it been certified or not? That's eventually where you're going with Berks. But being honest with you, those are 5 years off minimum. You know what I mean, to get to that point. But I'll tell you what I see the healthcare community need right now, as a guy who's been studying this now for a couple of years, is I can't imagine why there would be a fee or why any parent would have to pay to have their kid tested.
Yeah,
And that to me is an embarrassment to our health community here. I mean, I just mean it. It's $15. I mean, we've looked now. There's a $15 test is what it is for, I guess, special, qualified folks. But to me, if it just seems like there should be a grant somewhere saying, pay the lab for the $15 so that we can test as many as we can.
Yeah, and I think there is a coalition because our director of PEDS is on something with the city, and I'll check with her to know exactly what the something is to address exactly that point of looking at having everybody have the ability to get tested for lead regardless of insurance or cost. So there is some discussions on the city level for that to happen, but I don't know who's the sponsor of that initiative, but it's out there.
That'd be great if you could find out there's a way to do that, because we would definitely be, one. And I don't know if you know it, Dr. Keller or not, but there are, only a couple of times where they actually test kids.
Yeah,
and
I came from Baltimore in training, so I tested everyone down there, and I've been the habit to test everybody here. So I test a lot, but I know lots of other offices don't.
So if you came from Baltimore, that is a national success story, what they did down there.
Yep.
I participated in a seminar 2 years ago, Region 3. Baltimore was there, and the secretary Wheeler was there, and the whole bit. And Baltimore put on a presentation and got an award, what they did. And the statistics are unbelievable.
Mm-hmm.
I mean, they really, and that's Baltimore. So, that's huge. And I will say this, it was done through the federal money. It's the fact. So that's why we know we've got to go get these grants, or we can't afford to do it. There's just, you can't. The average home, it's about $20,000 to remediate a home.
Wow.
Yeah, Dr. Kelleher, when Dr. Kimball was on the board and we had some of these discussions years ago, it used to irritate her. She, of course, they screened everybody in their practice, but she was under the impression that a lot of more, shall we say, suburban practices, the pediatricians didn't do that. And because I guess, you think they're in newer homes, but you don't know.
And we're underserved community in the city of Reading, so we do screen everyone. But I similarly would say that a lot of the more suburban pediatric practices don't.
Yeah, she gave an example one time of some kid who had a high lead, and they searched and couldn't figure it out. And supposedly they were buying some cheap trinkets at the dollar store from China, and the child was teething on them. And it had, there was something baked on the outside of these beads were lead. That was supposedly the source.
My kids love Polly Pockets, and those were all off the market now because they were contaminated with lead from China.
What were they?
Polly Pockets. They were the biggest toy that every little girl had, and they were very high lead. And I had them in my house. Yep.
Can I ask, when you say we test everybody, what does that mean?
We have a protocol that if you're 9 months and considered high risk on a lead screening, that you get tested at 9 months, everybody else at 1. The recommendations are to then again repeat it if they're high risk. To be honest, I almost repeat annually, for 1, 2, 3, 4. If they're completely normal, I might not continue, but I almost test annually. We order a lot more leads than parents get though. So a lot of times we order it and the parents don't bring them in to get drawn. So that's one of the things that we struggle with, actually convincing parents to let their babies get stuck to have the lead level drawn. We don't do point of care testing. Baltimore told me not to do that when I was training there because it had a lot of false positives.
Yeah.
But we do venous sampling.
So let me ask you, let's just brainstorm in here. If I was to give you like a flyer, what Rawa is willing to do, and you have a person who has an issue and they want their water tested, and we'll test it for free. I mean, that's one of the big issues in this whole thing is the confidentiality and HIPAA and all that stuff. And I'm not interested in that. I'm interested in saying, if they call me and want their water tested, we test it now for them, no matter who it is. So we're not going to be doing anything that we're not doing. It's just that you'd be able to say, look, why don't you have YROC come out and test your water? And at least you've eliminated one of the two potentials, right?
Now, would that matter if they're homeowners or renters? Because I know a lot of them are.
I don't think my board's going to have a problem with me spending what I spend on a lead test. And quite frankly, what we would be doing is adding that to our lead program and lead and copper program that's required for EPA and DEP. So when they come in, I can say, look, I go this far. We're out there looking at and I mean this, if someone has lead service, either our service or their service, either one, we want to get rid of it. I replaced 2 last week that were ours. We ran into them on a main break. The guys called me and the whole pipe wasn't lead. There's where the small pipe goes into the big pipe. Back in the day, they made a thing called a corporation. It has a lead knot on the end of it, so you can do a transition. So we had to replace it. And while we're doing that, we just go all the way to the curb, just replace that whole section all the way to the curb. And then one of them was black iron, and that became a problem. And, we help them fix it. It is what it is, right? I mean, we're trying to help people.
And I will definitely connect you with, because it's not me, so I'm struggling with knowing exactly who is in this group, but there is an organization within healthcare of lead task force. I think they call themselves, or something, to address the problems of lead in kids in Reading.
Oh, there he is. Just when I was just getting ready to jump off.
My sincere apologies for being so late, but I just came out of the hazard reductions meeting with APA and the like. So my apologies.
I just gave him an update, Jamal, on our meeting and what Rawa's doing. And we were talking with Dr. Kelleher about the opportunity of maybe getting a flyer in her office so that when they have a problem, they can at least hand it to the person and say, well, Rawa will test your water for nothing, so just call them. And then Dr. Kelleher was saying there might be someone out there that's already supporting the $15 cost for lead. And if not, Dr. Kelleher, even if you find that you're, okay, well, that's $15 is being subsidized. And maybe if you could tell me how many of those $15 it's costing you every year, I might be able to get my board to generously, cover that $15 so we can offer it free.
And I think what the group is trying to figure out how to get people access to free or low cost lead testing. So
Yep.
You guys might be a very important part to contribute to that conversation.
We're in, right? And I have a board member here, so I'm sure that he agrees that, we're actively looking, and we're spending money on these things, and it makes sense. It's our community responsibility as a good steward of the water system.
Absolutely. And just to add on to that, Dr. Keller, we probably could provide some of this information, some of this cost through the CDBG program for needed families as well. Okay, but we would like to know what we are dealing with. Are we dealing with hundreds of dollars, or are we dealing with
Yeah.
thousands?
Yeah, I will definitely try to bring you guys into the conversation. It's our CEO and our director of PEDS who were in those kind of meetings, and I don't even know the details. So I will bring you into that conversation with them so that they know that you're willing to partner to address things.
If you don't have my email, you can get it from Shelley. Will send it to you, give it to you. And I'll be more than glad to sit down with anybody from any organization in reference to this. This is a citywide effort from the top all the way down to the bottom. We got to look after our kids.
Yep.
Any other additional discussion then on the lead abatement? I would be interested in seeing that YouTube video you referred to. Perhaps you can send the link to Michelle and she'll send it.
Yeah, I'll
out.
do that.
I'd be
I will do
interested
that.
to see it.
In fact,
Okay.
I'll do that now.
All right, good. And then moving on to new business, the only thing I wanted to ask Dr. Kelleher, I know you had mentioned last, oh, I'm sorry, let's back up a moment. I wanted to ask Jamal, when we met last, I think you had mentioned that the eviction moratorium had been moved up to the 31st of March, which of course is now passed. Could you give us a little update on where things stand?
Be more than happy to. We are moving on in a very good pace at this point. Actually, I would say that all the organizations, including human relations commissions, are working collaboratively with each other. The program that the city hosts itself through the Community Development Home Program and ESG program, and ESG stands for Emergency Solution Grant. Basically, these are moving very, very well. In fact, there is not a day that we do not approve what they call them invoices, which is actually payments to either the landlord or the affected families. But at the same time, there is also the program that Berks Development Authority is handling for the county, and that is a bigger, more encompassing program. And between both programs, I think we are doing very well at this point. I really don't have any statistics to say that any of the families were evicted, but I can share with you comfortably saying that yes, the program is going very smoothly, and we are keeping families in their places of residence.
Well, terrific. Thank you for the update and for your work. I know 6 months ago there were concerns of mass evictions, and oh my God, we're talking about getting hotels set up.
And it was, and actually the plan was in that directions. But thank God for 3 or 4 strategies that played together. And the very first one was that the court delayed the eviction process itself. Mm-hmm. And as a result of that, gave us a jump start on how we will be able to coordinate with the tenants. And the second part is that we did find a mechanism of which we will be able to pay not only 3 months or 6 months, but actually an entire year between utility and back rent. And these are the programs that pretty much keep families in their homes. So thanks to everyone's effort.
Yeah, oh, terrific. Glad to hear things are under control.
Thank you.
And then moving on to new business, I just wanted to ask Dr. Kelleher, you mentioned last time that you were involved in the process of some committee looking at the possibly forming a county-wide health agency or health department. Is there anything to report on that, just out of curiosity?
I think it's still a big debate because this pandemic, the question has been whether or not counties and areas that have a health department were able to kind of cohesively respond better. The vaccine rollout is one where people question whether if we had a health department who could receive vaccine directly, would it have been more successful? Sure. There are some that believe that it would, and there's some who say other places with health departments also had the same struggles, and whether or not the cost of a health department is worth it is, I think, where it weighs in. So the last discussions are still to discuss it, but I haven't heard any concrete direction.
Okay.
either.
All right. Any other business or would anybody like to discuss, or any other topics before we consider adjourning?
No?
I would like to bring in one point to all of you, and that is it's in early stages, but our managing director, in coordinations with the mayor, actually we are collaborating with Health Tower to create pop-up vaccine place locations, and that is I believe it's going to start the latter part of April through May.
Good. All righty. Then I guess the next meeting would typically be June 1st. I think that's the first Tuesday in June. So unless anybody has any known objections, why don't we at least put that down as a tentative date, unless anybody has any issues with that. And then I guess with that, I could ask for a motion to adjourn.
Make a motion, we adjourn.
I
Second? Okay, all in favor? Aye. All right, well, thanks so much for coming. We'll see you in 2 months. If anything pops up time, let us
Thank
know.
you. Thanks a lot.
Anything we can
Bye.
do, and maybe we'll have 2 new members next time. That would be terrific.
That would be nice.
All right.
Stay safe.
Thanks.
Stay safe.
Bye-bye.
Bye-bye.